Good evening. Welcome to our community forum. My name is Corina Herrera Loera, Public Information Officer for our Emergency Operations Center here for our County of Santa Clara. Today we have our guest, Ricardo Morales, who will be coming and giving us an update on the booster shots. I know there's updates have come up this past week, and we have several people who might have questions regarding the booster shots. So he will be updating us on those details. And I want to make sure that our community knows that you have the ability to ask any questions. So if you have any questions, feel free to put them in your comments regarding the booster. We will be answering questions regarding the booster shots once our guest updates us here today. So without further ado, I'm going to bring in Ricardo Romero Morales. Welcome, Ricardo. He is our lead public information officer here at our Emergency Operations Center. If you can give us an update as to the booster shots and what our community can look forward to, I think beginning today, and I know you have some good news for us. Welcome.
Thank you so much, Corina, and thank you for having me here and providing me with the opportunity to bring this message to our community. And as you mentioned, here in Santa Clara County, those who have received a second dose of Pfizer vaccine at least 6 months ago are now eligible to receive the COVID-19 Pfizer booster shots. They also have to make sure that they do qualify under the CDC and FDA guidelines. So meaning that they are at least 65 years or older, or are 18 and above who have an underlying medical condition or work or live in a high-risk setting. Now, it is important to know that this is only available for those who receive the booster shot. The Pfizer vaccine, at least the 2 shots. Many people in our county also received the Moderna vaccine and the Johnson & Johnson. But at this time, Moderna and Johnson & Johnson are going under review and approval, waiting for approval from the FDA and CDC's for its emergency use as a COVID-19 booster vaccine. So once that happens, we will be letting the public know when they can also go get a booster shot if needed.
Thank you so much. And I'm encouraging the community to ask questions. And while the questions start coming in, I am going to give a brief update. I see the presentation on finally, and let's see. In the meantime, what I'll do is I'll just go straight to the questions, because I know I want to make sure that we focus on the booster shots today. And I know that our community, has several questions already, so I'm just going to go there. We have T. Villarreal Alarco. Welcome, T. And he states, I just got my booster today. Do I need to wait for the 2-week period before it's effective, like the first dose?
Since this is just a booster shot, you should be able to feel good. So remember, you're considered fully vaccinated after you receive your second dose. So at this point, this is just a booster, which is going to help bring your antibodies to the level that they were right after you were considered fully vaccinated.
Thank you, Ricardo. And then we have our next question from Laurie. Laurie is asking, what area is considered high risk?
So, for example, if you work in an environment where you're in contact with others, such as working in transportation, working in a grocery store, working in a healthcare facility, or working anywhere else where you are exposed to people that you don't know their vaccination status.
Thank you. And then can you further a little bit more of the high risk? I know there's a certain age and, that might be at high risk. So also what that means in that age group?
Yes, of course. So currently the booster shot is for those who are 65 years and older, but also to those who are 18 and above who have an underlying medical condition or work or live in a high-risk setting. Same with the high-risk setting. For example, if they live with people who have a medical condition or a high risk of getting COVID-19, or they live in an environment where it's a congregated setting, then those people are also encouraged to get the vaccine.
Thank you. And then just to clarify, would diabetes be considered one of those for the 18 and over?
Yes. So diabetes, cancer, HIV, the CDC list is pretty broad at this point. So there's even saying that if you have anxiety, just thinking that you're going to be getting COVID-19 or that you could get COVID-19, that also qualifies as a high risk setting or as a high risk condition that is putting you at risk of COVID-19.
Great, thank you. And then we have Krista here who's asking, can Kaiser members receive boosters at county vaccine clinics, or do we have to go through Kaiser?
They can definitely come to our county sites. Just make sure that you bring your vaccination card. And this is to help us identify that you did receive, in fact, your 2 doses of Pfizer and that you are at least 6 months out since you received your second dose of Pfizer.
Great. Okay. And then we have Asha, who's asking, do pregnant women need a booster shot?
At this point, what the most important part for pregnant people is to making sure that they received at least their first 2 doses, that they're fully vaccinated. Depending on each case by case, the best recommendation is for them to talk to their doctor. But we do know, and the science has shown, that vaccines do work for pregnant people and are the best tool to continue to prevent us from getting severely sick and ending up at the hospital or preventing death caused by COVID-19.
Thank you. And then we have Susel, who's asking, I think, a similar question that you answered in the beginning, but maybe she wasn't on yet. And then it's important to repeat things because sometimes when we hear it 2 or 3 times is when we remember. So she's wondering, how many weeks after the booster are improved antibody levels seen? Do we need to wait some time between flu and COVID vaccines?
So to answer the how many weeks of boosters are? So yes, so it will definitely start happening right after you get your booster shot, and it could take up to 2 weeks. So you don't have to wait the 2 weeks because you're fully vaccinated to be considered fully vaccinated. Remember, this is just a booster to bring your antibodies to the level that they were right when you were considered fully vaccinated. So it could happen as soon as you get the booster, and it could take up to 2 weeks. Mm-hmm. And in terms of the second question regarding the flu and COVID, you can get both vaccines at the same time if you can.
Great, thank you. And then we have Margaret Shields, who's asking, or she's saying she had her booster today. Do you think this will be a 6-month redo from now on?
That is something that we still continue to learn about COVID-19 vaccines. But once we know more and the data is there, we will make sure to let the public know.
Great. And we have TV Arreal, who was just thinking about that. So I answered 2 questions there. And then Laurie's asking, is airplane travel considered putting yourself at high risk? This is just one trip, not a profession.
This is a high risk setting because it is a means of transportation in where you will be surrounded among people that you don't know their vaccination status. So this could definitely qualify as one of the reasons to get a booster shot, as long as this person received Pfizer at least 6 months ago.
Okay, thank you. And then we have Rosalba, who's wondering, how do you go about scheduling the booster?
Great question. So we have, starting today, we have multiple options. First of all, you can definitely go to your doctors to do that, or you could also come to our county sites. So you can visit sccfreevax.org, and where you can book an appointment to get your booster shot. You just have to fill out the questionnaire where it's asking you if you received your Pfizer doses at least 6 months ago. And then they will also schedule you for wherever site you're closest to. Now, we also have what we call our MOVAX clinics, which go around the county at different sites to provide vaccinations. Now, for the MOVAX clinic, people do not need an appointment. They can come in and without a previous appointment, and they can definitely receive the booster shot too. Again, just make sure that you bring your vaccination card with you to prove that you in fact were vaccinated with Pfizer and that you received Pfizer at least 6 months ago.
Thank you, Ricardo. And also on the sccfreevax.org, they can find the locations and times of different places, right? Close to them.
That's right. And then they have more information about boosters and as well as the third shot. So there is a lot of confusion in our community between the booster versus the third dose of the third shot. And I just want to reiterate that the fact that we're saying third dose is for those who are immunocompromised. Third doses are only for people who are immunocompromised, and they can receive either Pfizer or Moderna vaccines, and that is the third dose. On the other hand, the boosters are for people who are 18 and over, have either an underlying medical condition or work or live in a high-risk setting.
Thank you. Okay. And then our next question we have is Santa Clara County going to ramp up drive-through or outdoor vaccine clinics again to reduce the risk of acquiring COVID from the vaccine clinic itself?
So at this point, we do have a drive-through location in South County. That's where people can go get a vaccine through the drive-through. And also our testing site at the fairgrounds has now expanded and is now back at where it was a couple months ago. So people can definitely use those drive-through options.
Thank you. Okay, and then we have Florence, who says, today I'm getting my third shot. Is it okay to have the flu shot too? And I think you answered it, but if you can tell us again.
Yes, definitely. You can receive your COVID-19 vaccine as well as your flu shot.
Thank you. And we have Scott Pearson, who's saying, why is this shot being called a booster and not a third shot? What makes this booster different from the first two?
So this is a booster, which means that for those who receive Pfizer, as time has been passing by, what we've learned is that the antibodies start to decrease for Pfizer recipients at this point. So what we want to make sure is that you have the full protection that you had as soon as you were considered fully vaccinated. And on the other hand, for those who are receiving the third dose, is because they are immunocompromised and their body takes or needs a third shot to be considered fully vaccinated.
Thank you. And we have TV Villarreal, who's asking, when will 12 plus kids that are able to get, probably high risk, able to get a booster shot maybe?
Yeah, at this point, we haven't heard much information about the CDC in terms of people who are 12 and over, 12 to 18 to 17 in this case. But we hope that pretty soon, once the studies are, all the data is presented to the FDA and the CDC, I'm sure that we'll be making an announcement and we will be making sure to let everybody else know as well.
Great. Thank you so much. And we have Kamala, who's saying, what are the underlying conditions covered? Is it things like obesity, diabetes, blood pressure, or other more serious conditions? If you can repeat that, please.
Of course, you got it. So yes, so it's anywhere from severe conditions such as cancer, HIV, but also obesity, diabetes, high blood pressure, anxiety. So all of those do qualify as being one of the underlying medical conditions.
Thank you so much. And Ricardo, I don't see any more questions for now. What I'll do is I'll give the update that I usually do in the beginning. I'll give it at the end now. Thank you so much for your time. And remember, community, we have these every 2 weeks. And actually this week, we're going to have a BiNational Health Week event on Friday online as well. So there'll be opportunities. I don't know if you want to share anything about that, Ricardo, since we're here with the community.
Of course. So BiNational Health Week is here one more time, which BiNational Health Week happens every year in the month of October. And what BiNational Health Week or month is, it's actually an opportunity for all of our community partners and local government agencies to get together and provide and bring educational material and services to the most disproportionately communities here in our county. In this case, the Latinx or the Spanish-speaking community. So this year, we're going to be having multiple events throughout the month of October, in where people can get COVID-19 vaccines. They could also get dental screenings, vision screenings, testing for HIV, as well as any other type of resources that they might need in their language. In Spanish, we'll make sure to have Spanish, English, and Vietnamese at all of our health fair events. And we have Our first kickoff event will be taking place this Saturday, October 2nd, at the Blanca Alvarado Resource Center, in where we'll be bringing all of these services to our community.
Muchísimas, thank you so much. Muchísimas gracias in Spanish, right? I think, it's very important to connect with our entire community. So here we are with our English-speaking community, definitely open and to provide as many resources and services as needed. And then our Spanish-speaking, we will have this community forum in Spanish at 4 o'clock today with the same information, but in Spanish. So if you know anybody, your aunties, uncles, parents that maybe speak Spanish, have them join us in Spanish at our Spanish Community Forum. And then, as you heard Ricardo, we have the BiNational Health Week events coming up in the month of October. Look out for those. We will have the updated flyers with information on our Facebook pages coming up. So with no further ado, Ricardo, thank you so much for coming. I'm going to give an update. I'm going to close up with my update, and we'll see you at 4 o'clock at the Spanish one.
Great. Thank you so much, Corina. And remember, this is the best time to go get your booster.
Thank you so much. Take care. And now I'm going to give the update, as I mentioned, that I usually do. We have our COVID daily updates as of yesterday, the 28th of September. We have 88.5% of our 12 and older with at least one vaccine dose, and 83.7% of our 12 and older who completed the entire vaccination. And we have 187 new cases, a 7-day rolling average as of yesterday. Next slide, please. If it will go through. And if not, then that'll be our update for the day. If we can't go to the next page, that'll be our update in regards to our vaccines. And now, there it is. But just a reminder, as Ricardo mentioned, we have the Pfizer booster shots available right now. In regards to the vaccinations by race and ethnicity, in specific to the Hispanic Latino community, we're at 71.2% of our community that's been vaccinated, which still leaves 130,639 that are not. I think another thing that I want to highlight is in the past 2 weeks, unfortunately, I know 2 cases where 2 males have passed away, and these are sole providers for their families. And for whatever reason, they did not have the vaccine. And we know that, when a family loses a sole provider, that really impacts that family. And sometimes to the point where, as we know here in Silicon Valley, it can even depend between being unhoused or not. So many reasons to get our vaccine, to be healthy, but also those impacts of our family. If something happens to us and we're not here, what that can mean. Next slide, please. If it can go to the next slide. We have Gloria, who's helping us in the background with the slide. And if we're unable to, then I'll go ahead and go to maybe our last couple comments here and questions. It doesn't look, there we go. So our SEC COVID-19 case rates by vaccination status, to me, it's important to share with the community. It's kind of like, well, why should I? Or is there any difference really if I get my vaccine or not? Some people are still on the fence. And so here it shows that the case rate for the unvaccinated folks ages 12 and older, they are 31.9% of the COVID-19 cases. And so if you see those that are fully vaccinated, they are only 5.8% of those that have COVID-19. Not just that, but even those that have COVID-19 that are vaccinated, just a reminder, I know we hear it all the time, but it's important to understand that those folks they don't get serious symptoms. So whether it's being on ventilators or even ending up dead, that 5.8% is not getting those serious symptoms, while the 31.9% of those that are getting COVID-19 that are unvaccinated are seen with the most serious symptoms. So it's important to understand that it's not just, oh, my friend told me, or I, read somewhere, or I saw in the news, or I heard on the radio. It's the actual facts here in our county. Next slide, please. If we're able to move forward. Our internet connection is probably a little slower. And then, as you heard from Ricardo, booster shots are available now. If you received the Pfizer vaccine, then and you fall under the people 65 years and older, residents of long-term care facilities, people ages 18 to 64 with an underlying medical condition, people over 50 with an underlying medical condition are strongly encouraged to get a booster shot. We mentioned earlier, some of those are diabetes, obesity. There's a list of those cancer. So they're encouraged. And then people ages 18 to 64 are at risk of COVID-19 exposure because of occupation or institutional setting. And so those folks are able to get the third shot, the booster shot. Moderna is still not available. It's still going through the different studies that it needs to go through to be approved. And so those of us who received the Moderna, we are still not able to get that booster shot. Next slide, please. And just a reminder to please keep your children at home. Those of us who have school-aged children, if they have fever or chills, have a cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, nausea or vomiting or diarrhea. And make sure to get your child tested and yourself. If your child tests positive for COVID, then have them isolate immediately and then notify their school. Then as a school setting, then they're able to do the close contacts and ensure that there's minimal exposure to COVID-19. And so what does isolation mean? Keep your child home for 10 days since the symptoms started. And then if there's no symptoms, isolate them for 10 days since the first positive test. And give them their own space, keep items away from others as much as possible. If possible, have them use their own restroom. If not possible, just ensure that, it's being cleaned regularly. And then find a free test site at seccfreetest.org. You can find a testing site near you, but ensure that you get your child tested if they have any of these symptoms. Next slide, please. And then ensure that you check your child's mask. Sometimes we're like running out and it's like, here, make sure you put it on. But ensure that it goes over the nose and under the chin. And then make sure that it fits nice and snugly against the face without any big gaps around. And then pinch the nose, pinch down the nose piece for a tighter fit. So, ensure that they're their size. Ensure that they have an extra one too. I would say as a mom, put an extra one in their backpack because you just never know. They take it off at the bathroom or something. If they have an extra one, that they can always put that on, especially while at school or away from you. And then masking don'ts. Don't wear a mask underneath the N95. Don't use a mask under your nose or chin. And don't use a mask with an exhalation valve. And don't use a neck gaiter, bandana, shirt, or scarf. I know sometimes we're, run out and you're like, oh, well, I'll just use my shirt or put my shirt over. That is not going to protect you. Always carry an extra one in your car too, or in your bag to ensure that you always have a face mask available to you. Next slide, please. And then these are some of the drop-in vaccine sites. As Ricardo mentioned earlier, you're able to go to any one of these if you're eligible for the booster shots and get them. In regards to the test, the seccfreetest.org. You can also make appointments online and get information. Go there. That is the best place. Also, the seccfreevax.org. If obviously the wording here is really small, but here you will see the different locations and you can find the one closest to you and also one that fits your schedule. So we understand that people have morning jobs, afternoon schedules, and maybe only available on the weekends. And so there's a list with different opportunities as to where you can go to get your vaccine and get tested. Next slide, please. And just a reminder to the Santa Clara County Isolation and Quarantine Support Program. You might be eligible for hotel placements, groceries, household and baby supplies delivery, financial or rental assistance to qualifying residents of Santa Clara County. If you test positive, we want to ensure that our community has what they need in regards to resources to get through that isolation time and quarantine support. And so if you have any needs around that, you can call the Access Services at 808-7770. Once again, 408-808-7770. And the hotline is available 7 days a week from 8 a.m. to 6 p.m. Your call will be returned within 24 hours if you leave a voicemail. And then make sure we also have it available in different languages. So feel free to leave the language that you feel most comfortable with, and you'll have somebody to return your call in that language. Next slide, please. And that might be our last slide. Yes, thank you so much, Gloria. So thank you all. I am skimming through the questions here before we end. I did see the question, as I mentioned, the answer to the Moderna. Still going through trials and going through the different studies needed in order to ensure that it's ready to be out. We have Erlinda, who says, thanks for always sharing. Thank you, Erlinda. We have Rodrigo Garcia, who works with me at the Emergency Operations Center. Thank you for joining us. He did put several resources on here. So here's one of them where we're going to keep the community updated specifically on the booster shots. So feel free to take that down if you'd like, or go to our, or this is actually the CDC who has an update. But we will continue to update also our sites through our dashboards for the county with the information. And let me just go through the questions specific to the booster or anything that we can answer today. Thank you, Rodrigo. Also in regards to sharing the SEC free vax to make appointments. And then this is our site, as I mentioned, through the county to receive information on COVID-19, vaccine, etc. Any of those also graphs that I went over, you can get them through our covid19.secgov.org to get updated. And let's see, we have Suzelle. Is the county planning to update school symptom protocols for when kids get vaccinated and have fever due to vaccine? That's a good question, Suzelle. I know that's something that can be answered through the Santa Clara County Office of Education. We've had a few events where we have them as guests. So I think this is a good question to end on, as I know we as parents have several questions in regards to schools. Maybe it'll be a good time to bring our Santa Clara County Office of Education representative back to be able to ask these specific questions when it comes to schools and have him answer. So I can't answer that right now, but I will invite our Santa Clara County Office of Education staff to help answer those. Thank you again. Thank you for joining us today. Remember, we are here every other week to bring the most updated information. As Ricardo mentioned, we will have our BiNational Health Week events coming up for the month of October. So we'll have live events for that, specifically to the BiNational Health Week on Fridays, beginning October 1st. And we will be back here at the Community Forum in 2 weeks. Thank you all for joining us, and have a good rest of your afternoon.